Just in time for flu season, Health Canada has approved the first ever RSV vaccine for adults 60 and older. And while experts are praising the move, use of this shot could be limited, which means hospitals might not see relief until next year.
Having a vaccine that would reduce the risk of severe RSV and lower respiratory tract RSV would be a significant benefit. It certainly has the potential to keep people out of hospital, keep people safe, alleviate pressures on the healthcare system.
RSV season typically runs from October until May. Although the virus is common, those with underlying conditions are more likely to become severely ill or require hospitalization. While there are RSV treatments for infants, doctors say the mortality rates in older adults is sixfold compared to children under 1.
While for many of them it can also present as a common cold, it's more likely to end up having older people land up in hospital, end up with severe complications, and far more likely to die from an RSV infection than, say, a young child. So we've been waiting for decades for an RSV vaccine to be developed.
The manufacturer, GSK, says the clinical trial, with nearly 25,000 participants, shows the vaccine, which is called RSV, was 82% effective at preventing lower respiratory tract disease caused by RSV and 94% effective at preventing the illness in those with underlying medical conditions.
For this vaccine specifically, it was designed for an older adult population, and it's because of the unique needs that they have with their immune system and function declining as they get older. So the design of the vaccine itself is really particular and tailored to the older adult population.
But experts say it's also important to monitor how effective the vaccine is in real-world situations.
Is it going to do what we want it to do? What is the true effectiveness of this vaccine in preventing lower respiratory tract infection? What is the true effectiveness of this vaccine in keeping people out of hospital? Are there rare side effects?
The Public Health Agency of Canada says the new vaccine would likely be available for limited use during this respiratory season, with the National Advisory Committee on Immunization not expected to issue official guidance on the vaccination until 2024. They say it will be up to provinces and territories to adjust their RSV programs to include this vaccine.
We know that those who are most likely to benefit are older adults who may also have an underlying chronic health condition. That's actually most older adults, and especially those who are living in long-term care settings. So if we have a limited supply, I'd prioritize those people.
Doctors say RSV can present similar symptoms as the flu or even COVID-19. And while the manufacturers don't have an exact date yet, they say they are hoping to roll out these shots here in Canada sometime in September or October when RSV season begins. For City News, I'm Leah Johansen.